Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. I'm going to show you guys how we treat plantar fasciitis, and then I'm going to show you some alternatives that you guys can do at home. We've also done some videos. I've done a great video on some stretches for plantar fasciitis and exercises, which we're going to give her because she's leaving for a trip, right?
Yes.
So she's leaving for a trip, and she's only been able to treat a few times before leaving. She's going to be doing a lot of walking and hiking, I think. So, yes? No? Yes. Okay. So a lot of on her feet. So we need to get her ready for this trip, and we don't have a lot of time. First thing, I put some lotion on her feet, and we're going to use a ROCKBLADES, GRASTON. A lot of different companies make these. You can buy them even on Amazon for like 30, 35 bucks. Some of the cheaper ones. Really, it's stainless steel. It's fine. Any of them are fine. You don't need to spend $500 on these tools. Make sure you use some sort of lotion. It does not have to be like an icy hot. It can just be lotion, regular lotion. We're going to go ahead and strip it about 30 times. So we're going to do about 30 strokes, and we want to do it in different directions. And for those of you that don't know what plantar fasciitis is, and I've already explained it to you, so you understand it, right? The condition, but it comes from people being flat-footed. 99.9% of people with plantar fasciitis have flat feet. So you can pretty much guarantee you're flat-footed. We have 3 arches in our feet, and a lot of people just think of the medial arch on the inside of the foot, but that's not the only arch we have. And that's the main arch, though, that causes plantar fasciitis. When that arch collapses, it's very common to develop plantar fasciitis. And so now we're getting into the insertion of the plantar fascia. And then after we do this GRASTON technique, so we're going to do some cold laser therapy and adjust her ankle. But something I want to go over with you guys is what you can do if you don't have one of these GRASTON tools. Again, you can go on Amazon, buy them for about 30 bucks, 30, 40 bucks, give or take. Or you can use a lacrosse ball. Buy one for 5 bucks online on Amazon. And roll your foot over the lacrosse ball. The third option is to take a bottle of water, a round one, don't use a Fiji bottle, and ice it and stick it in the freezer. Don't crack it open, keep it sealed. And then roll your foot and your heel over that iced bottle of water, and that will ice it down, calm the inflammation down, and it will also stretch the tendons out and the plantar fascia. Okay, done with the right foot. Now we're going to do the left foot. This one's bad. Yeah. Okay, so we're going to go a little easier here on her medial arch here on this foot because she's real sensitive. And with this tool, you can actually, I can feel the adhesions. They're better than they were the other day. I could just feel it through the stainless steel. And that's why they make these tools out of stainless steel, because you can feel the vibrations through the steel, and you can feel the tone of the muscle and the fascia through this device, which is nice. Okay. So as you could see here, folks, or maybe you can't see, I hope you can see from this angle, I'm using different strokes in different angles. Sometimes that can be difficult depending on what joint you're working on, but you want to try to switch it up as much as possible. The direction and the angle of the strokes to loosen up these adhesions. How are we doing there? You okay?
Yeah, all right.
Right there's a spot that's bad. Now, I know this really is irritating to her, but we have to kind of break through this. Okay. Now we're done with the GRASTON technique. Obviously, GRASTON's probably going to be a little bit better than the methods I gave you, but it's certainly a start, and it's a lot cheaper. Now, if you've been doing those stretches for 3 weeks to 4 weeks and it's not improving, then I would go seek out some professional help and get it taken care of that way. And then I would also make sure you go get orthotics. Some of you may be considering going and getting like those over-the-counter orthotics that you can get, like Dr. Scholl's. It may make your plantar fasciitis a little better, but it's not going to clear it up completely. In very rare instances will it do that. Those supports are generic supports just for the medial arch. They don't address the lateral or the transverse arch. And if you have a problem with the lateral or the transverse arch, which most people do with plantar fasciitis, then that's just going to give you 20-30% relief. So you're probably going to need to go and get fitted for a proper pair of orthotics. I like Foot Levelers. That's a good company. There are other ones. You can go to a podiatrist. I've seen a lot of bad orthotics made by podiatrists, so be careful with that. They kind of have you stick your foot in a molding and have you stand up. I'm not a big fan of doing it that way. There's a lot of room for error, and the last thing you need is an error, even to the millimeter. So you really have to have orthotics precise and perfectly accurate to make a good orthotic and correct the arches. So let me go get my laser. We'll show you how we do that. So we're going to go a little deeper with the laser because it's our last day before her trip, and I just want her to have some relief before she goes. Now I can scan the foot too. Watch, I'm able to detect areas of inflammation, but because the plantar fascia is pretty small and I know exactly where to find it, I don't really need this tool as much. When I say this tool, I mean the stim that allows me to find the areas of soft tissue damage or inflammation. I typically just use the laser itself without the stim in an area like this because, again, it's a small area and we know where all the points are on the plantar fascia. So we do a couple of minutes on each foot, and what the laser does is it reduces inflammation, reduces muscle spasms, and pain as well. You saw there it beeped. It tells me how long to treat the area. There's another inflammation point, and that's right at the insertion of the plantar fasciitis, right on the inside of the heel. So again, plantar fasciitis, stretching, strengthening, reducing the inflammation. And most important for long-term help, orthotics. If you don't get the orthotics, the plantar fasciitis will come back. Might be a year, might be 5 or 10 years from now, but it will come back. And then you risk damaging your knees, your hips, and your lower back. So if you're flat-footed, there are other problems that go along with that, and those problems happen much later down the road, 10, 15, 20, 25 years down the road. Now you have arthritis in both knees, but you never fell, you never had any trauma to your knees or never had any sporting injuries, but now you have arthritis. And the reason for that is because people are flat-footed. They don't correct the joints at the bottom, which would then change the kinetic chain up above the feet, the knees, the hips, and the lower back. So as we're scanning her foot, it found a few areas of inflammation. We'll do the same thing for the other foot. And this is a 50-watt laser, so this treats the area quicker. The treatment times are faster. We offer rental lasers. Those lasers take a little bit longer because they're 15-watt versus this 50-watt one. Yeah, we've got one last spot. So 50-watt laser, we did 5 minutes on that foot. So a 15-watt would probably take at least 10 minutes per foot. And there we go. And a lot of people ask me whether these glasses, whether I need to wear the glasses, that I should be wearing them. Yes, I should be, but they're safe not to have them on. I'm not shining it directly in my eye. Also, this is a Class 1A laser, so it's much safer than Class 4 or 1 would be. So, but no matter what kind of laser you're using, you just want to make sure you do not shine it in your eyes directly. And this is pretty much it, but we're going to adjust her ankle, or at least check, see if she needs an adjustment, and we're going to adjust the arch today. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.